This presentation summarizes the findings of our recent publication under the title Making Patient Blood Management the New Normal as Experienced by Implementors in Diverse Countries, which has been published in the BMC Health Services Research Journal in 2021. For the research, we interviewed implementers from 11 countries on their experiences with patient blood management in their respective environments. These implementers identified as the most important drivers for implementing patient blood management, patient outcomes, cost savings, and preventing blood shortages. In addition to that, they identified other drivers such as patient safety, education awareness, quality assurance, as listed on the left side of the slide. The implementers identified the following barriers as important in the implementation of patient blood management. And the most important are on the top left side and then going along the line towards the right. So the most important here were change of work practice, the need for collaboration across stakeholders, the feasibility of integrating patient blood management in the current processes, perceived costs, strong belief in transfusion, and the limited or no experience with patient blood management. Overcoming these barriers requires a culture change. And the process of cultural change has been described by Cotter, and I want to quickly go through that here on the right side. You start with establishing a sense of urgency. Why is it important to do patient blood management? What was wrong with the previous practice? Then you create a guiding coalition, which means you find allies in your environment who help you to do this together. Together you develop a change vision. You communicate this vision for getting buy-in in your environment. You empower a broad-based action by creating training programs, by giving people the means to do this in their environment, and by supporting the introduction with sufficient funding. You generate short-term wins by doing pilot programs in which you collect data to show that this works in your practice and what kind of results it has in the practice. Never let up refers to the need to re-emphasize and educate all the time. A one-time training will not change practice. It needs to be reinforced all the time so that eventually it becomes incorporated into the culture of the organization. Interviews, we've identified 6 levels of implementation which contribute to a comprehensive adoption of patient blood management, and that is the policy level, the funding level, research level, the level of care provision, medical education, and the patient and public level. Starting in the middle with care provision, the aim is to implement best practice based on evidence and multidisciplinary engagement, and the outcomes will be improved quality, improved patient outcomes, and safety. The aim on the research level is to measure cost and outcomes related to patient blood management and transfusion practices, and the outcomes will be augmented evidence for context-related best practice, outcomes, and cost. On the funding level, the aim is to invest in the most efficient clinical pathways for patient blood management and transfusion, and the outcomes will be cost containment and improved profitability. On the policy level, the aim will be to coordinate a nationwide drive for evidence-based patient blood management practices with the outcomes of improved equity, lower need for donor blood, and improved quality of care. On the medical education level, the aim will be to teach best practice consistently across the clinical community, and with the outcomes that patient blood management becomes the new standard of care and there is improved consistency of patient blood management practice. On the level of the patients and the public, the aim will be to increase demand and acceptance for patient-centered best practice, with the outcomes of improved patient satisfaction, shared decision-making, and informed consent. Now we've identified many measures across these 6 levels for intervention, which will help in the comprehensive implementation of patient blood management. And I will not go into detail on each of them, but just mention a few examples. On the care provision level, it is important to have somebody who coordinates that, a champion who drives this forward, and creates like all the tools needed and the training programs and the communication and the pilot programs needed to do this. On the research level, it's important to identify metrics and collect data for benchmarking before or after, but also across organizations. International exchange, publications, identifying the best methods in the process. On the funding level, it means cost transparency, not only for blood costs, but also for the cost in context with patient blood management and the cost savings across the different funding silos. On the policy level, it means a national policy and national approaches, for example, cross-specialty guidelines, or implementing PBM as a part of quality certification. And then on the medical education level, it means the integration in the curriculum at the medical university, but also the integration in continuous medical education programs, and in the communications in the specialty associations for best practices. On the patient level, it means a move towards participatory medicine to enable patients and carers to actively participate in the therapeutic decision. It could also mean to collaborate with patient advocacy organizations for communication and dissemination and more transparency. Important are these activities across stakeholders, like multi-stakeholder collaboration in specialty societies, task force or work groups, or in the efforts for communication and giving messages to all, which are aligned across stakeholders. I'd like to spend a few words on the guiding coalition. It means to understand who are the stakeholders to be involved in each element of your implementation. There are a few key questions. Who has interest in the specific step or activity? Who can help? And then who may feel threatened, and what may help to overcome this anxiety with those people? Who should be part of the initiative in each level of the intervention? Who can we access directly or indirectly, and what do they need? What kind of information do they need to be persuaded? This is a typical stakeholder analysis. You can make that in an overall frame or on each level and each different type of intervention to see who are the important stakeholders who have to be involved in this or who may be helpful in achieving that. Here is an example of how you could start implementing patient blood management when you're based in a hospital. The first step is to identify opportunities which are under your own influence and to find allies in the clinic to do this together. Also to find allies in the administrative part who will support the initiative from the administrative viewpoint. Then you start to initiate change. This could be to develop protocols, to educate participants, For this, you may need budget, where it helps to have the administrative partners to help you to reallocate funds to this activity. You form a steering group within the organization. You inform about their findings, your progress, you celebrate if something positive can be shown, and you continue to educate and improve the practices. On the research level, you start to measure and then benchmark from the beginning. So you collect data on the blood use, on outcomes, complications, cost, hospital stay, process, satisfaction, and so on. For this, you need data collection. You may need IT support. Again, that it helps to have the administrative back. You communicate internally and externally, and you continue to inform and celebrate your progresses. Once you've done your first pilots, you may expand the opportunity within the hospital or even beyond. You publish your findings nationally, internationally, depending on what it is, and you ally with other stakeholders and other hospitals who will help to expand this. This may be in a multi-specialty societies, the creation of guidelines and instruments which help to guide this in the country, on a health policy level, the education part in the university, and also the interaction with the patient community and the public to increase awareness about the evidence supporting patient blood management in clinical practice. You may use social media to strengthen all these networks you're building within the organization, but also across organizations. Here are a few publications which may be helpful in preparing your own programs. You will find much more in the manuscript, which gives also much more details on the different actions you could take for implementation. With this, you may be ready to your first step to plan how to implement patient blood management in your own environment, and we wish you all success possible in this. Thank you very much.